first video, okay, administering enteral nutrition via syringe, okay? I'm going to show you guys.
Ensure privacy and place your supplies near the client's bedside. Introduce yourself and explain the procedure to the client. Perform hand hygiene. Use 2 acceptable identifiers to confirm that you have the right client.
Can you tell me your name and date of birth? Brooke Baxter.
Check for an allergy band. If the client is able, verbally confirm the allergy. If the client does not have an allergy band, confirm that the client has no known allergies. After performing 2 of the 3 medication administration checks prior to entering the client's room, perform the 3rd check by comparing the formula with the provider's order to make sure you have the right client, the right feeding, the right dose, the right route, and the right frequency. Assess your client's learning needs. Make sure she understands the intent of the feeding and any possible adverse reactions. Don gloves. Assess for any signs of redness, swelling, irritation, bleeding, drainage, or skin breakdown. If you find any of these conditions, consult with the provider. Assess gastrointestinal tract function by auscultating for bowel sounds. Absent bowel sounds may indicate decreased motility. You should report this to the provider. Check the expiration date, the integrity, and the cleanliness of the formula container. The formula should be at room temperature to avoid gastric cramping. Shake the formula well. Cleanse the top of the canned formula with an alcohol swab and open the can. Verify tube placement by using at least 2 methods after initial verification by an abdominal X-ray. Confirm the length of the tube at the point of entrance with the order and documentation to make sure the tube has not dislodged. Inject 30 milliliters of air into the tube to clear it of formula, medication, or flush solution. Gently pull back on the plunger to aspirate 5 to 10 milliliters of fluid. Assess the appearance of aspirate and its pH to help confirm placement. Clear the syringe and inject 30 milliliters of air. Test the pH of the fluid you placed in the cup.
I'm just going to check the residual volume on your tube.
Next, measure the residual volume by aspirating until you feel resistance from the plunger.
I'm just going to flush your tube with a little bit of water so it doesn't get clogged.
Once you obtain the residual volume, return the residual fluid and flush the tube with 30 milliliters of water. Follow your facility's policies and procedures for returning aspirated contents to the stomach. Contact the provider about excessive residual. typically more than 250 milliliters, or when the tube placement is in question. To begin the feeding, pinch off the proximal end of the feeding tube. Remove the plunger from the syringe and attach the barrel to the feeding tube. Fill the barrel with formula and release the feeding tube. Elevate the barrel above the client's head. The formula flows by gravity through the tube. Refill the tube until you deliver the prescribed amount of formula. Follow your facility's policies and procedures for how often to check the blood glucose and intake and output of clients receiving enteral feedings.
Okay, your feeding's all done. Just going to disconnect here.
Flush the tube with 30 milliliters of water.
I'm going to flush the tube with some water.
Gather and dispose of all waste in the proper receptacle. Remove gloves and perform hand hygiene. Lower the head of the bed to no less than 30 degrees.
Tell me when you're comfortable. That's good. Okay.
Document the feeding, dose, solution, volume, time, and your initials. Document the client's response, especially any adverse effects related to the feeding or the infusion. Use these same procedures when administering tube feeding through a gastrostomy or jejunostomy tube.